Hi, welcome to this week's edition of Enthralling Conversations. Today, I'm very pleased to be interviewing Dr. David Ficker, who is a neurologist at the University of Cincinnati. So David, I will start where I always do. Who are you, where are you, and what is your professional role in the epilepsy community?
Yes, thank you, Laura. I'm pleased to be here with you this morning to chat. So I'm Dr. David Ficker. I'm a neurologist and epilepsy specialist at University of Cincinnati Gardner Neuroscience Institute in Cincinnati, Ohio. And I've been there for 24 years.
Oh my, a life.
Yeah. And I'm also the chair of the professional advisory board of the Epilepsy Foundation. And I've been in that role for about a year now. I have another year of tenure coming up.
Yeah, we've got you for one more year, so you're stuck with us for a little longer. And tell me, how did you choose neurology as your specialty?
It goes back to medical school when we were learning about the nervous system. I was really excited and interested in learning about the nervous system. I thought it was probably the neatest part of the body to really study and learn about. So that really got me sort of geared up and involved in neurology.
And have you been at University of Cincinnati your entire career?
I have. I came there out of my after completing my fellowship in epilepsy.
Wow.
Yeah.
Interesting. So tell me about your family a little bit.
So I'm married. I have 3 daughters. The youngest is just turned 20. The oldest is 28 and just got married over the summer.
Oh,
so that was an exciting time for us.
Great. And they were able to have a real wedding, not a pandemic wedding?
We had a real wedding. Yes.
Yeah. Well, I don't know how it's going to be going forward.
Right.
Yes. You got that little window of time and it was a good place.
I think so. Yes.
So thank you so much for giving me a little bit about your background. I'd like to switch a little bit and talk about your role in the epilepsy community. So obviously you're at an epilepsy center at the University of Cincinnati. You're an epileptologist or just a neurologist?
I'm an epileptologist. So that means I've completed additional training in epilepsy and EEG monitoring. And my practice really focuses on seeing patients and treating patients with epilepsy and seizures.
All right. And so I know that you do a lot in the EEG monitoring arena. So tell me about what that tells you. Do you see new innovations in that field? Kind of what's going on in the world of EEG monitoring? Yeah,
so EEG monitoring is where patients have basically EEG recording or brainwave recording continuously. Most of the time that's done in a hospital setting where patients are brought into an epilepsy monitoring unit to try to record seizures and determine types of seizures they're having. And that helps us determine potentially the best treatment option for them, whether that's medication options or patients might be candidates for epilepsy surgery. And so for the roughly 1/3 of patients with difficult to control seizures, epilepsy monitoring offers an opportunity to really personalize their treatment depending on the type of seizures they have.
So you obviously do that in your center, but
Correct.
What about all the new, we're seeing a lot of constant, even passive EEG monitoring, different types of technology that are being put in place so people don't have to be in a hospital or a center setting. So what are you seeing on that horizon that's kind of new and exciting?
Right. So there are a number of companies that will offer in-home video EEG monitoring where patients don't have to be in the hospital setting. The disadvantage of that is that you can't stop or decrease their seizure medicines, which you typically do in the hospital setting to try to capture seizures. But we definitely see people who come into the hospital setting and they're in a different environment and their seizures don't occur when they're having monitoring. So potentially having home EEG monitoring in their home where their stressors are present may be a good way of recording or capturing seizures.
Got it. And so when you think about the field, you've been in the field you said you've been at Cincinnati for 24 years, I think. So you've been around for a long time. What are the changes that you've seen and what are the changes that you think need to happen?
Yeah, so I think, we've seen a lot of advancement in our treatment options. We have a lot of new medications. Unfortunately, they don't work for everyone. And so we have a lot of future opportunity for improving our treatment options for epilepsy and also for some specific types of epilepsies, including the rare epilepsies. But there's been some great advancements over the years in devices for treating patients who are not surgery candidates, deep brain stimulation, the responsive nerve stimulation. We've had vagus nerve stimulation for quite a number of years now, but all 3 of those devices offer potential treatment options for patients with epilepsy. We have also had advancements in our surgical techniques, most notably laser ablation, where a small laser probe can be placed in the region of the brain where seizures come from and potentially stop or cure that patient's epilepsy. So those devices and lesser invasive surgical options are really exciting to see.
And so I'm sure you're familiar with our project. We funded a project called My Seizure Gauge, and it was really trying to, kind of build an algorithm with a device that can actually do seizure prediction.
Yes.
So do you think we're on the cusp of actually seeing seizure prediction?
Yeah, I think we're not there yet, but we're heading there. I think it's really an exciting area. Particularly, the biggest, issue I see in patients with seizures is they're unpredictable, and that uncertainty of when that next seizure may occur is really challenging for the patient and family members. So if we have some type of, again, the seizure gauge, My Seizure Gauge is a way of potentially predicting an upcoming seizure would be fantastic. I mean, the patient at that point can take precautions or even potentially, administer a treatment that might be seizure preventative at that point.
Right. Or rescue therapy of some sort.
Right.
That those are on the market as well. And so if you think about, the device area is really exciting. And frankly, from our perspective, we see more innovation and research being done around technology and devices versus meds. In the medication arena, do you see any advances or do you see things that need to change?
Yeah, I think when we look at the medications that have been approved, the overall treatment response is very similar among each medication. They're not, unfortunately, blockbuster agents that are curative or prevent the progression or prevent epilepsy. So, if we're looking at treatment options, and this is sort of the holy grail of epilepsy treatment, is to prevent epilepsy. In somebody that might be at high risk, is there a treatment that can be given to prevent the development of epilepsy? There's been a lot of work in trying to understand that and develop treatment. Unfortunately, we're not there yet, but that would be really, an ideal way if we can prevent the development of epilepsy.
And from a general research perspective, I know that there's a lot of research now on genetic types of epilepsies, the rare epilepsies.
Yes.
There are, areas that you think really need more attention in the research arena.
Yeah, I think, any type of research in understanding why epilepsy develops or why seizures occur. We have, there are, as you mentioned, the rare epilepsies may have a genetic component, but they're, sort of the more quote unquote common epilepsies may have genetic components as well. And I don't think we really understand those types of, for the majority of patients who have epilepsy that aren't rare, if we could get a better understanding of the genetic mechanisms or even genetic predispositions to which medications or which treatments might be beneficial for that patient would be ideal. So you can personalize, the treatments for a particular patient.
So you mentioned that you're currently the chair of our professional advisory board, which is wonderful, and you've got one more year left. What do you see as the role of the PAB for the Epilepsy Foundation?
Yeah, I think there's a lot of different roles. Part of the one of the great things that for me has been seeing what all of what the Epilepsy Foundation does, whether that's programs and services, funding research, exciting things like the Shark Tank competition, seeing some of the cool things that people want to potentially develop for epilepsy, and the advocacy role that the Epilepsy Foundation does. So I think as a PAB member, there's a lot of opportunities to get involved in those different areas, and provide input and feedback to the Epilepsy Foundation staff about potential future directions. That sort of two-way interaction between, the professionals that are involved in taking care of patients with epilepsy and the EF staff really is where I think that PAB sort of role is great.
So, Dr. Ficker, one last question for you. If you could wave a magic wand and change something in the epilepsy field, what would it be?
Boy, that's a tough one. I think, the ideal thing would be to have a single treatment that works well for everyone. That would be sort of the ideal situation. I think more realistic goal would be, we see a lot of patients who have not been to an epilepsy center in a timely fashion, that may be years after their poorly controlled seizures. So I think, in the more short term, I'd love to see, patients. I would love to see a patient earlier in the time course where their seizures are not well controlled, rather than, 15, 20 years
Later.
after the diagnosis. So I think greater recognition of among patients, families, and healthcare providers that the epilepsy centers are there, that they offer potentially, advanced treatment options for patients with epilepsy. So that's sort of a more short-term sort of magic wand sort of thing that I'd love to see.
Yeah, I agree. And I hope you can find a magic wand. So, well, Dr. Ficker, it's been so nice to talk with you today. And at the Epilepsy Foundation, we really appreciate that you've spent the time to be on our PAB and now to lead it. So thank you for all your efforts on our behalf and on the behalf of the epilepsy community. We appreciate it.
I appreciate it. It's been a great opportunity for me and a great experience for me as well.